Assalamu alaikum. I am Dr. Meherun Nesa Akhi, lecturer, Department of Community Medicine and Public Health. Today I will be discussing about tuberculosis, which is a burning question around the worldwide. About tuberculosis, we will get to know about the definition of tuberculosis, and we will learn about the global and Bangladesh scenario of tuberculosis, and how this tuberculosis spreads, and how does the preventive measures should be applied, and understand about the drug resistant tuberculosis and this co-infection along with HIV AIDS. First of all, what is tuberculosis? Tuberculosis is an infectious disease that most often affects the lungs, and it is caused by the bacteria Mycobacterium tuberculosis. About the global scenario of tuberculosis, worldwide tuberculosis is the second leading infectious killer disease after COVID-19 disease. A total of 1.3 million people died from tuberculosis in 2022, including the infections with HIV. In 2022, an estimated 10.6 million people fell ill with tuberculosis worldwide, including 5.8 million men and 3.5 million women and 1.3 million children. The ending the TB epidemic by the 2023 is among the health targets of the United Nations Sustainable Development Goals. And to combat the tuberculosis, global efforts have estimated that about 75 million people are affected by the tuberculosis, and for the multi-drug resistant tuberculosis, it's also a public health crisis and security threat for health. Only about 2 in 5 people with drug resistant tuberculosis access treatment in 2022. About the tuberculosis scenario of Bangladesh. Bangladesh is one of the 30 high tuberculosis burden countries and accounts for 3.6 of the global total. The estimated incidence of tuberculosis per lakh population is 221 in Bangladesh, with a mortality rate of 24 per lakh population. Approximately 80% of all TB cases in Bangladesh are pulmonary tuberculosis. About the here is a slide of a location of TB cases in Bangladesh. Now comes the epidemiology of tuberculosis. About the we will get to know about the agent, host and environment, and how it interacts to cause tuberculosis infection. About the agents, Mycobacterium tuberculosis complex, which includes Mycobacterium tuberculosis, Mycobacterium bovis, Mycobacterium africanum, Mycobacterium caneti and few others atypical mycobacteria. About the source of infection, the source can be both human and cow. Smear positive cases are real sources of epidemiological relevance. The commonest source is the sputum of the patient. Bacilli may be found in pus, pleural fluids, peritoneal fluids, urine, feces, etc. Milk and milk products, meat for bovine in case of bovine tuberculosis. Now comes the period of communicability. Not highly communicable disease and is communicable so long as the bacilli are excreted from infected person as long as remain untreated in case of open cases. About the host factor, age, there is no exemption of age regarding age. Children are more higher risk, at higher risk, most fatal in their first year of life. That's why we are given to vaccination, BCG vaccination. About sex, it is 3 times more among the males. Along with the tobacco user, malnutrition, and suppressed immunity and diabetes patient, it's predisposing factors for tuberculosis infection. Other predisposing factors such as disease like malaria, influenza, measles, carcinoma, congenital heart disease, it's also act as a predisposing factor for tuberculosis. In case of pregnancy, surgery, gastrectomy, physical injury and stress, this condition also predispose the infections. About the environmental and socio-economic factors, poor housing, the overcrowding, as Bangladesh is one of the crowded country, and its humid condition also enhance the infections. Also the ignorance and poverty that causes the low awareness among the people about the tuberculosis disease. About mode of transmission, it can be transmitted by inhalation or ingestion in case of bovine infection, and in incubation period it may extend from weeks to months or even years. About the prevention of tuberculosis, we know the cure is the best prevention. Preventive measures can be taken through by intensified case finding or identification, contact tracing and investigation through BCG vaccination, tuberculosis or preventive therapy, and TB infection control. Now comes the most important thing that helps in prevention of tuberculosis, that is vaccination, BCG vaccination, which is a live attenuated vaccine, and it is given just after the birth, and it is not fully protective against TB disease, but it provides some protection against severe forms of tubercular meningitis and biliary tuberculosis. Duration of the protection is 15 to 20 years. Now we got to know, we'll know about multi-drug resistant tuberculosis, TB, which is caused by bacteria that are resistant to isoniazid and rifampicin, the most two effective first line of TB drugs, and that is called multi-drug resistant tuberculosis. The causes are mainly inappropriate prescription, poor quality of drugs, and incomplete treatments. Multi-drug resistant tuberculosis is treatable and curable by using second line drugs. However, second line drug treatment options requires extensive medications which are can be expensive, and also toxic effects are seen in them. Now comes the co-infection of tuberculosis along with AIDS. People living with HIV are 16 times more likely to fall with tuberculosis disease than the people without HIV infection, and the leading cause of death among the people with HIV is also tuberculosis. HIV and tuberculosis form a lethal combination that speeding the process of the outcomes in HIV patients. Infection with HIV leads to suppression of the immune mechanism of the body, and they increase the chances of the reactivation of dormant bacilli many folds as compared as to those without HIV infection, which cause the deadly combination with HIV/AIDS. TB is most important life-threatening opportunistic infection associated with HIV. We know the rate of progression to clinical TB at least 30 times higher among those infected with both tuberculosis and HIV. The TB accounts for at least 1/3 of the AIDS death worldwide and 40% in Asia. Between the 56 to 80% AIDS cases in India, Thailand, Nepal, Myanmar, and also have tuberculosis. Now comes the tubercular control program, which is launched in 1991 under the further development of tuberculosis and leprosy control service of Bangladesh government. The vision and mission of NTP, which is National Tuberculosis Program, is to eliminate the tuberculosis as a public health program from Bangladesh, and its mission is aimed to strengthen the effect of tuberculosis control. And by the effective partnership which can be achieved, and mobilizing resources and ensuring quality of diagnostic and treatment services under defined DOT strategy. And the services should be equally available to all people irrespective of age, sex, religion, ethnicity, social status and race. Here is a picture showing the NTB strategies which will be achieved by the year 2035. and the strategies of the TB control. And here is the periodic show of, here showing picture showing the periodic concept of strategies and to control TB. Now comes the DOT strategy, which is adopted by the recommendation of WHO by the year 1993. DOT strategy is a directly observed treatment short course service, which is present at the OPD and under the Upazila Health Complex sub-center or in the many government hospital. It is a DOT providers are there to provide DOT strategy, that is supervised by the health assistant, health inspector, community health worker, Shastha Sevikas, village doctors and village leader or cure TB patients. Now here is a slide showing the tuberculosis stigma. We know that there is a proverb saying jar ha jokkha tar nai rakkha. TB is mostly stigmatized in our society. The manifestation of stigmatized by we show the evidence to the TB patients or making gossips around them, verbal abuse, discrimination from medical staffs or in a working place, loss of employment also is seen because of the tuberculosis infection. As a consequence, the people are become self-isolated and they are affected by psychologically. So it's also effects on takes effects on health. We should know about these stigmas, and we should also discourage this and to bring about them to the better effect. We should control the tuberculosis spread and to ensure we should ensure the treatment procedure efficiently and regularly. Thank you.